CBD has been shown to be a strong antioxidant. So our body accumulates free radicals. We accumulate them just by the simple process of aging. The simple process of eating food on a day-to-day basis creates free radicals. Certainly, if we smoke cigarettes, we're going to really increase the amount of free radicals present in the body. So they can happen from things that we do to ourselves or things that just happen day to day. By taking CBD oil, you're giving yourself that extra boost of antioxidant protection. So think of someone eating blueberries for antioxidants. Taking CBD oil can almost be thought of, and at least this is the direction the research is going, as blueberries on steroids when it comes to protecting against free radical damage and oxidation damage. Now, specifically, I tell people that most people with autoimmune diseases, they're starting to find that these individuals have lower levels of naturally occurring cannabinoids. We've said this in headache patients. We've said this in cardiac patients. We're seeing this over and over again. By taking CBD oil, you're helping your body balance out its own natural levels of cannabinoids, which in turn should provide you with more antioxidants present in your body. And that's really the direction I like to go with that. You have the antioxidant properties of CBD that we're seeing, and then you have this balancing act. And in the immune system, it's really a fascinating thing that they're seeing. So you have receptors all over your body, CB1 and CB2 receptors. CB2 receptors are pretty involved with your immune system and your immune system response. Now, when it comes to autoimmune diseases, you have an overactive immune system. So they give people immunosuppressant drugs to turn it off. What they're finding with CBD oil, at least in some of the preclinical trials, is that when it binds to these CB2 receptors, if the immune system is overactive, it seems to quiet it down. It seems to turn down the volume on the immune system. Now, here's the coolest part. If that person does come across a viral infection or a bacterial infection, it almost is appearing that CBD is still allowing for an immune system response in those instances while still keeping the really, really bad autoimmune system response at bay. And I think that's one of the most exciting things, because you have to ask, how is that possible? Now, they're trying to look into the interplay between CBD and the endocannabinoid system, but from a balancing act, it's turning down the volume, but not too much, enough to hopefully offset some of these symptoms, but still allow that person enough of an immune system response to fight off other bad things as they come in. And I find that one of the most fascinating things when it comes to CBD and autoimmune disease. Now, I want to make sure that was my whole point. Yeah, and then we, of course, talked about the anti-inflammatory effects of CBD as well. So you really have three ways it's helping. It's a strong antioxidant. It's turning down the volume on patients who have an overactive immune response. And then, on the contrary, people who have an immunocompromised system where their immune system is not active enough, it almost appears that CBD is giving them a boost. And this is why we're so torn on the research right now, especially in trying to set up clinical trials, because for one person, it's helping to boost their immune system. And then for the person who has an overactive immune system, it appears that it's turning down their immune system. We're still trying to explain this, but for the time being, it's very exciting. We usually start people at a lower dose. Let's say it's from a prevention standpoint. And I mean, this is my opinion, what I'm about to say with this next comment. I have a family member who's very prone to autoimmune disease problems. Cousin of mine, very prone to cancer. It's very strong in their family. So looking at the literature, I made the recommendation, look, I think you should take this from a prevention standpoint. Now, she had some issues with sleep and anxiety as well. So when I was trying to figure out what would be a good amount, a good serving size for this individual, I said, well, listen, let's see if we can find a dose. And we started at 20 milligrams. She wound up taking 80 milligrams a day, a dose that can help balance your sleep, balance your anxiety a little bit. And that's where we're going to put you. And that's really what we did. Now, after a few months, she started to sleep better. She said, hey, I think I need less of this. We cut it back, and now she takes 10 milligrams a day as a maintenance level. My suspicion is she maybe had lower levels of cannabinoids to start with. They balanced out. Now she's doing better, and she's at that maintenance dose. So from a maintenance standpoint, for a healthy individual, if you don't necessarily have symptoms that you can track and monitor as you go through the dosage, this is, again, my opinion. 10 to 50 milligrams a day, I would think would be more than enough for most. Now, if someone has an advanced autoimmune disease, you can really start to monitor their symptoms, right? So there's videos online of people who have, I want to say it's Parkinson's disease with the movement disorders. You can see this in MS too, to an extent, where they'll find a dosage and that individual will actually stop having those spastic movements. That would then be the dosage that I would recommend once we see those clear symptoms dissolving, once we see the pain going away. Most people with autoimmune disease have gastrointestinal symptoms. A lot of times in our office, when we're trying to find that appropriate amount for them, we're monitoring their GI system. And if they're coming in and saying, hey, I don't really have that IBS anymore, and I'm not waking up just bloated out of my mind and very uncomfortable, we're starting to say that's a good dose. Most people, I would say anywhere from 20 milligrams a day, where we have some people upwards of 200 milligrams a day. And I would love to say the worse the disease, the more they're taking. That's just not technically the case. If you look at literature, one of the main authorities on this topic would be the book CBD, A Patient's Guide to Medical Cannabis. They would recommend for full-blown autoimmune diseases that you're between 50 upwards of 400 milligrams a day. So once they have the disease, we try and look at symptoms, and that's how we try and pick it. I don't know if you've experienced this. It's rare. I find if people take too much for them, that they seem to report a dull headache. It's temporary. It lasts for like an hour, but I've seen that with a handful over the almost maybe going on a year and a half, 2 years I've been doing this. If they get that, I usually just recommend cutting back a bit, and that seems to do the trick. And again, that's completely just my observation.